Oriental, of course, the theme this year resonates with me very strongly as during these tiring times we are faced with the COVID-19, since January this year. And of course, we would like to endeavor to keep all our healthcare workers in Oriental safe, all right, in order to provide a safe environment for our patients, their families, their visitors, as well as our own internal clients as well. With the safety culture as well, and being a clinician as well, we always focus on the 6 international patient safety goal, which I think is very important. Okay, where we identify our patients correctly, improve communication. But this year, because of the pandemic, we focus more on infection control purposes and our practices on infection control. So last week, in prepared for patient safety, and in fact, our nursing team actually put up a very good video in regards to the 4 patient safety goals as well that was displayed. And we even have posters that say "Speak Up for Safer Care." And in fact, for this as well, for this event, we actually also developed and created our own Oriental Safety Pledge. We came out with the Safety Pledge of the hospital, and we actually displayed our Safety Pledge. And we involved, the clinicians, the healthcare workers, the patients, their relatives, as well as our visitors as well. Of course, this. So what we're doing now, what I'm doing here now at Oriental is that I want to. We are starting on the safety culture project, okay? And with the safety culture project, we would like to aim to optimize behaviors and practices, okay, resulting in an improved safety culture that would reinforce and support the prevention of patient harm. Is that we have run a series of safety culture in services, as well as to make people aware of the importance of just culture. When an error occurs, I believe that we should not just hide the error, but to be brave enough to report it, okay, and to be brave enough to address these issues, to see how we can use these incidences as a way of improvement as well. In the just culture, we actually encourage open reporting and participation in prevention and the improvement of an incident when it occurs. And OSH, this is where the occupational safety and health policies needs to be put in place. You need to have a safety officer that works and put in place as well, because a part of an organization with infection control together with the safety officer, we have to work hand in hand. Because infection control, you look at, how to prevent infection, but in safety, as a safety officer, you look at the whole organization, per se. You don't only look at clinical staff, but you also look at the clinical staff as well. So, of course, as a leader, we have to continually strive, to improve on these both aspects. Guys, you know what? We have to do a pandemic policy as to how to address, a situation when we are faced with this. And this policy should be a general policy. It should not just look at COVID, but it can cover airborne diseases, or any type of disease outbreaks, right? When this pandemic started, like I said, we didn't really have much of an issue because the policy was there to guide us. And in fact, the staff were even informed about the policy, and we, in the infection control and the safety officer, actually provided a lot of training, on the ground to make the staff and even our doctors, our consultants aware of what's going on. You don't only just deal with pandemic as such, but you also deal with natural disasters, and where we are located as well. And this is where risk management comes in, identifying your risks, and looking at the location of where we are. Okay, we are very near the sea. So if a tsunami hit, then we will be able to then look at, go back to our crisis management and say, okay, this is, in case a tsunami hits, or in case if a typhoon hits and there's flooding, then this is what we will need to do. So in fact, I'm glad to say that, we have these crisis manual, risk manual, pandemic policies, and our infection control policies, as well as our safety policies, are all in place. These are very important, in the event if the hospital run into a crisis, then at least you will know what to do when you refer back to your man.